John Swinney will be aware of the case of Brooke Paterson, a 19-year-old footballer who broke her leg while playing in North Lanarkshire on Sunday. Despite the clear medical emergency, Brooke was left lying in pain on the pitch under jackets and coats for 5 hours until an ambulance arrived. The ambulance service blamed the 5-hour delay on hospital turnaround times, which they say ranged from 90 minutes to 3 hours in the area. And the ambulance service has now apologised. But it's not them that have broken the system. So isn't it John Swinney that should be apologising to Brooke?
First Minister. Well,
I apologise to Brooke Paterson because I've read the story this morning and I've made some investigations this morning about the issue. So I regret very much the experience that Brooke Paterson had. As I've looked into this morning, and there'll have to be further scrutiny about this because I've had limited time to look at this morning, it looks to me as if an error was made in the classification of this particular call, which has not had the priority it should have had. Now, that's what it looks like from the basis of the limited time I've had this morning to look at that. And that's not acceptable. That is an error that has been made, and we have to look into whether that is the case and whether there are other steps that need to be taken to remedy that. But what I would say is that the efforts the government is putting in to resolve the challenges that will sometimes affect the ability of the ambulance service to respond, which is about congestion of ambulances at hospital, requires a whole system response, which is about ensuring that we reduce any delays that individuals experience in leaving hospital. So delayed, where 97% of patients leave hospital without any delay to their discharge. About the availability of social care, about the throughput of different accident and emergency departments to make sure that the ambulance service is able to respond timely. Now, all of these issues are issues that are at the heart of the points made by the Royal College of Emergency Medicine, which is why I said in my earlier answer that the Government is addressing the issues that are raised by the Royal College because they reflect the whole system challenges that we face in the aftermath of COVID.
Anna Sarwar.
That's 819 apologies from the First Minister to people he's failed across the country in just a few minutes. Across Scotland, our NHS is on life support. In 2018, on the SNP's watch, the maternity facility in Stranraer was closed temporarily. 7 years on, it's now permanently closed, putting women at risk. And the mothers I met are distraught. Claire Fleming said that her cousin had to travel from Stranraer to Dumfries to give birth. She ended up having to pull into a farm drive and have her baby there. Angela Armstrong, a retired GP, added, "My fear is that we're going to have a death." Every part of our NHS is struggling on John Swinney and the SNP's watch. So what does John Swinney say to all those families who have lost loved ones due to long waits, to all those who have waited hours in pain for an ambulance, and to these mothers in rural communities who can't access the maternity care they need because of his government's incompetence?
First Minister.
As I've indicated, and I've indicated this since I became First Minister, that I recognise there are challenges and weaknesses in the provision of healthcare system of healthcare in the aftermath of the pandemic, and I am absolutely focused, along with the Health Secretary, on addressing all of those issues. So, what is happening in the National Health Service today? Well, what we're finding, as I've indicated in my last answer, that 97% of discharges from Scottish hospitals happen without delay. We are seeing that the number of appointments and procedures that were originally promised in our programme for government is not the 213,000 extra expected, exceeding our commitment by over 60,000. The number of operations performed in July was the highest in 5 years, an increase of 8.9% compared to July last year. And the number of hip and knee operations reached an all-time high in 2024. Now, in some of the issues about maternity care that Mr Sarwar raises with me, some of those will be considered, will be assessed in relation to clinical advice about the sustainability of services in some rural areas in Scotland. And that's a difficult issue, but the Government listens carefully to clinical advice. I think Parliament would expect the Government to listen carefully to clinical advice. But there's also something else that's difficult. Our National Health Service depends upon the flow of staff coming from other countries to support us in the National Health Service. And I have to say to Mr Sarwar, our challenge in that respect is being made extraordinarily more difficult because of the immigration policies pursued by the United Kingdom government. These policies are absurd. They are making it more difficult to deliver public services. 26% of social care staff in Scotland are people who have come from other countries to this country. The UK Labour government is making that much more difficult. I suggest Mr Sarwar should try to get his Labour government in London to take a different stance on immigration, and we'll all be better off as a consequence.
Question number 3.